Well, hello everyone. Thank you so much for joining us today. I'm Anu, Director of School Services here at Liricare and a former school special education director of related services, and I'm really excited to be here for what I know will be a super insightful conversation. For anyone tuning in who's not familiar with Liricare, let me give you a quick background. Liricare was founded by Samir, who has a strong passion for supporting special needs professionals. His goal has always been to create tools that address the challenges faced by SLPs, OTs, and other healthcare providers. Liricare is a platform designed specifically for SLPs and other professionals in the special needs community. On Liricare, you can share content with your peers, connect with other professionals, and join a number of specialized groups. Our goal is simple: to make your work easier and support your career growth every step of the way. Today, I'm thrilled to welcome Raegan Stanley, an amazing SLP who's been using Liri AI in her practice. As a reminder to our wonderful audience, if you have any questions, please put it in the chat box for us. We'll also send a Q&A document from this live webinar. Hello, Reagan.
Hi there.
Thank you for joining me today, and I'm excited to learn about your experience with the new AI tool from Liricare. To start, could you briefly introduce yourself and your background in speech language pathology?
Yeah. So I'm Raegan. I've been a speech language pathologist for over 9 years now, and I've worked across many settings, so schools, hospitals, and I've done a lot of telehealth, just to name a few. And yeah, I'm here today because I'm pretty excited to tell you about my experience with Liricare AI.
Great, great. Now let's dive into your experience with Liricare AI tool. What motivated you to start using this tool in the first place?
Yeah, so Anu, one of my passions in speech therapy is evaluation. So I've structured my work life to really take advantage of my strength in this area and to allow me to further develop in this unique niche. However, I quickly found myself limited in the number of patients I could assess and help because of the increased amount of time that goes along with documentation for evaluations. So, therefore, I started looking for ways to streamline my documentation about a year ago and really started looking a lot at AI because it's what everybody was talking about at that point.
Sure, yes,
Yeah,
yes.
I'm back.
Okay, phew.
I was talking about how much I love technology.
Yes, yes.
So how far did you guys hear?
Just the beginning that one that you're tech savvy, so that's
Yeah.
how you were able to jump back in so quickly on there. So
Oh,
appreciate that. So I'll just repeat the question again. How
okay.
has the implementation of this AI tool changed your daily workflow?
Yeah. So as I was saying, I am tech savvy. Actually, a portion of my evaluation is actually done by a form that's filled out ahead of time by the parent or caregiver. And this really enables me to avoid getting drawn into a long conversation with a parent and then running out of time to work with their child during the evaluation. So I take all of this information and I plug it into the AI software before the appointment. I usually still have some questions regarding the parent interview and I'll ask them during the evaluation. From there, though, we move on to the actual evaluation with standardized and informal assessments. And I'm able to input most of this information in real time during the session. And I also take a break for a few minutes to calculate scores and percentiles towards the end. At that time, I can usually input a bit more data and then I report this. Yeah, I'm not sure what happened there.
Okay.
So I think I was talking about reporting out my scores,
Yes, yes, exactly.
and then I go over my recommendations and wrap up the session. So following the session, I do finalize the AI data just to look through it and make sure that it's all correct. So I still do have documentation time, very minimal. But the nice thing is that now everything's recorded and I can come back to it when I have a few minutes afterwards to finish it up.
Gotcha. Can you share specific tasks or paperwork that have been automated? How much time do you estimate this saves you each week?
Well, honestly, I haven't been able to implement the AI across all my tasks yet. However, I
Right.
look forward to saving 12 to 15 hours weekly in evaluation documentation time. I think if I were doing therapy sessions too, the time benefit would be even greater.
Hmm. That's an interesting point that you bring up with the whole time management issue on there. And I think a lot of SLPs can relate to that. uh, yes, it's one of those days. That's okay. So I was just saying that time management is a big issue for all speech therapists, I imagine. Would you
Yeah.
agree with that?
Yes, absolutely.
Gotcha.
I mean, I
So,
have one job where
right,
from the time I walk in the door to the time I walk out of the door, I am booked back to back sessions.
wow, okay. How has the reduction in paperwork affected your interactions with your clients or patients?
Yeah, so the AI really enables me to be more present during my sessions where I don't have to worry about writing the words down. Really honestly, I've hated that since grad school where I was supposed to make a complete verbal transcript of every word that fell out of the patient's mouth. Um, it really enables me to actually hear the things my patients are saying. And I think that's something that we all really want from our providers, right? To feel like we're being heard and what we're saying matters, not just on a clinical level, but also on a personal level.
Yes, definitely. You bring up a really good point with that on there. Have you noticed any changes in patient outcomes or satisfaction since using this tool?
Yeah, well, as I don't really deal with patients past the evaluation, I may not even be aware entirely of how it's impacted their outcomes. However, I have had a few diagnoses that would have been easy to miss if I wasn't completely paying attention due to documenting. So, I had a 14-year-old girl recently with an undiagnosed stutter that I was able to recognize, and she and her mom were so relieved and validated that there was an actual speech issue. I had another patient that I referred for further evaluation for central auditory processing disorder who had no other diagnoses. Again, her mom was so relieved to feel like they were finally making some headway on her journey.
Wow, that's a really powerful story, and it just highlights the huge impact that you have on your patients, on parents, and thank you for sharing that story with us. I really appreciate that. Are there any challenges you faced while using Lira AI tool, and how have you addressed them?
Yeah, so one thing that I found challenging is the specific form I use for my evaluations is very particular. However, with some finessing and watching the recorded tutorials, I've been able to overcome this. I think another big thing to realize is that it may not be perfect immediately. And maybe what you want to think about is automating the most time consuming part. So, that for me tends to be my impressions and recommendations for expressive, receptive, and social language. And then move on and automate the next most time consuming part. So, just to think of it about, you know, you can't really dedicate a long weekend to doing this is one way to think about it. But the other way is, okay, well, I have 20 minutes now. Maybe I can get part of the way there. And, you know, kind of going back to what I alluded to earlier, I still don't have the AI across all of all of my different work functions, but it's already saving me significant time. So just thinking about it in more of a piecemeal way can be more productive way to address the problem.
Gotcha, gotcha. And that's a really good point that you make on there. As you continue to use this tool, what feature or improvements would you like to see in the future?
Yeah, so one thing that I've been working on and also working on with Liricare is um, that that form that gets sent to my parents ahead of time. I'd like to have it interact directly with the AI platform. This would even further decrease my administrative burden, as it does take me 10 to 15 minutes to input that information into the platform before the session.
Gotcha. Do you think AI tools like Lira AI will become standard in the field of SLP, and why or why not?
Yeah, so for me, from a personal standpoint, I've seen too many therapists, mostly OTs and PTs, as there are so few of us SLPs that are actually out there. Um, but, really at the beginning of my career, they were getting pushed out of their professions by technology. At that time, it was the inability to complete electronic health records and electronic documentation records. So, having seen that, I decided pretty early on in my career to really embrace technology. And obviously, that has something to do with how I ended up here. We've seen it, and we keep hearing about the changes that are coming. Productivity standards just keep going up. And sometimes it's a luxury to take 5 minutes for yourself. Having a tool like this really enables me to meet those standards, but also not feel so pressured and end up burning out in this field because I love what I do and I want to be able to help people. And and I don't see AI going away. I feel like I use it for so many things, and two, I'm hearing about um, all of the new things that everybody's working on with it. So yeah, I feel like it's probably here to stay.
Well, thank you for sharing your insights today. And you bring up a good topic for maybe another time is SLP and burnout, because there have been so many speech therapists that I've talked to. And one of the questions I say is, how much do you love paperwork? And as you can imagine, not too many people love paperwork. So if we have a tool that can help reduce that time that they spend with paperwork and spend more time having meaningful conversations and therapy sessions with clients, that's a win-win for everybody on there. So really appreciate that. Raegan, is there anything else you'd like to add about your experience with Liricare or the role of AI in this SLP world?
Yeah, you know, this AI is just a great way to improve your enjoyment of your work. It lets you see more patients, and ultimately, it can enhance the care that we're able to offer. Of course, there's a cost for the AI after the free trial. However, I would encourage anyone considering that cost to really contemplate two things. So, first, there's the benefit to the patients, as there's so many patients out there waiting for an SLP. And this tool really enables us to start working with some of those unfortunate patients and addressing those ever expanding wait lists. Secondly, there's the potential to increase your own income. If you can see one additional PRN patient every other month from the documentation time savings, it more than pays for itself. However, I'll admit it's not for everyone. If you don't want to do PRN work and you're comfortable with your productivity standards and documentation time, maybe it doesn't make sense for you. However, in my experience, most SLPs would certainly benefit from this.
Well, thank you again for taking time from your busy schedule. We really appreciate your valuable insights. Are there any questions from our audience members, Archita?
No questions yet.
Okay. Well, thank you again, Raegan. Really appreciate you taking the time to be with us on this live webinar. This is first of many, so we really appreciate you are our #1 visitor there. So thank you, and we look forward to hearing about your journey as you work with the AI tool, and really encourage other people to look at how AI can help reduce their paperwork. Thank you.
That's great. Thank you.
Thank you, Raegan. Thank you, Anu.